What if a simple vitamin could be the key to reducing the pain and discomfort of arthritis? Today, we'll explore the fascinating connection between a common vitamin and its powerful effects on arthritis. Welcome to Levitas. Arthritis is not a single disease, but rather a broad term that encompasses over 100 different types of joint disorders. The most common forms of arthritis are osteoarthritis and rheumatoid arthritis. Osteoarthritis, often referred to as wear and tear arthritis, occurs when the cartilage that cushions the joints wears down over time, leading to pain, stiffness, and swelling. Rheumatoid arthritis, on the other hand, is an autoimmune disorder where the body's immune system mistakenly attacks the joints, causing inflammation, pain, and joint damage. Arthritis can affect any joint in the body, but it most commonly targets the hands, knees, hips, and spine. The symptoms can range from mild discomfort to severe pain and can significantly impact a person's quality of life. Despite its prevalence, many people are unaware of the underlying causes of arthritis and the potential strategies to manage and alleviate its symptoms. Arthritis can affect people of all ages, genders, and backgrounds, but certain groups are at higher risk. The likelihood of developing arthritis increases with age, as the wear and tear on joints accumulate over time. This makes older adults particularly vulnerable, with nearly half of all people over the age of 65 experiencing some form of arthritis. Women are also more likely than men to develop rheumatoid arthritis, although the reasons for this gender difference are not entirely clear. In addition to age and gender, other factors can increase the risk of arthritis. These include a family history of the disease, obesity, and previous joint injuries. Obesity is a significant risk factor because excess weight puts additional strain on the joints, particularly those in the lower body like the knees and hips. Joint injuries, whether from accidents or repetitive stress, can damage cartilage and increase the likelihood of arthritis later in life. Understanding these risk factors is crucial for identifying who might be most susceptible to arthritis and taking preventive measures to reduce their risk. Arthritis is more than just joint pain. It can have a profound impact on overall health and well-being. For many, the pain and stiffness associated with arthritis can make it difficult to stay active, leading to a sedentary lifestyle. This lack of physical activity can contribute to a host of other health problems, including obesity, cardiovascular disease, and diabetes. Furthermore, the chronic pain and fatigue that often accompany arthritis can lead to mental health issues, such as depression and anxiety. Arthritis can also limit a person's ability to work, particularly if their job involves physical labor. This can lead to financial strain and a decreased quality of life. In severe cases, arthritis can lead to joint deformities and disability, further complicating treatment and care. Given its widespread impact, it's clear that managing arthritis effectively is essential for maintaining overall health and quality of life. The question of whether arthritis can be reversed is a complex one. Currently, damage to the joints, especially in cases of osteoarthritis, is often considered irreversible. However, this doesn't mean that all hope is lost. While we may not be able to completely reverse the damage, there are ways to slow the progression of the disease and improve joint function. Early intervention is key. By adopting a healthy lifestyle, managing weight, and staying active, individuals can reduce the strain on their joints and potentially slow down the degeneration of cartilage. In addition, treatments, such as physical therapy and even surgery, can help manage symptoms and improve joint mobility. Recent advances in regenerative medicine, like stem cell therapy, are also showing promise in repairing damaged cartilage, though these treatments are still in the experimental stages. Reducing arthritis symptoms involves a combination of lifestyle changes, dietary adjustments, and medical interventions. One of the most effective ways to alleviate symptoms is to maintain a healthy weight. Excess weight puts additional stress on the joints, particularly those in the lower body, exacerbating pain and inflammation. By losing weight, individuals can reduce this strain and experience significant relief from arthritis symptoms. Regular physical activity is also crucial. While it might seem counterintuitive to exercise when you're in pain, staying active helps keep the joints flexible and strengthens the muscles that support them. Low-impact exercises like swimming, walking, and cycling are particularly beneficial for people with arthritis. These activities help improve joint mobility without putting too much stress on the joints. Dietary changes also play a significant role in managing arthritis symptoms. Consuming a diet rich in anti-inflammatory foods, such as low-glycemic fruits, vegetables, high-quality proteins, and omega-3 fatty acids, can help reduce inflammation and ease pain. In particular, foods like fatty fish, wild berries, nuts, seeds, and leafy greens are known for their anti-inflammatory properties. Additionally, avoiding processed foods, sugars, and trans fats can help prevent further inflammation and weight gain. What is the vitamin that alleviates arthritis? One vitamin that has gained significant attention for its role in alleviating arthritis symptoms is vitamin D. Vitamin D is essential for maintaining bone health, as it helps the body absorb calcium, which is necessary for strong bones. But its benefits go beyond bone health. Vitamin D also plays a crucial role in modulating the immune system and reducing inflammation, both of which are key factors in the development and progression of arthritis. Studies have shown that people with low levels of vitamin D are more likely to develop rheumatoid arthritis and other inflammatory joint conditions. This is because vitamin D helps regulate the immune response, preventing it from attacking the joints and causing inflammation. Additionally, adequate vitamin D levels are associated with reduced pain and improved joint function in individuals with osteoarthritis. Vitamin D also helps slow the progression of arthritis by promoting the repair of cartilage, the tissue that cushions the joints. Evidence so far suggests that maintaining optimal vitamin D levels is a simple and effective way to support joint health and alleviate arthritis symptoms. Getting enough vitamin D can be challenging, especially for those who live in areas with limited sunlight or spend most of their time indoors. The best natural source of vitamin D is sunlight, as the skin produces the vitamin when exposed to UVB rays. However, depending on your location, time of year, and skin type, you may not be able to get enough vitamin D from sunlight alone. Fortunately, there are other ways to ensure you get enough vitamin D. Foods rich in vitamin D include fatty fish, like salmon, mackerel, and sardines. Egg yolks and cheese also contain small amounts of vitamin D. For those who find it difficult to get enough vitamin D from diet and sunlight, supplements are an effective option. The recommended daily intake of vitamin D varies depending on age, health status, and exposure to sunlight. For most adults, the recommended daily intake is around 600 to 800 international units, but experts suggest that higher doses are necessary for those with arthritis, particularly during the winter months, around 5,000 international units or more. It's important to consult with a healthcare provider before starting a vitamin D supplement to prevent any adverse effects. In conclusion, arthritis, encompassing over 100 types of joint disorders, profoundly affects millions worldwide, with osteoarthritis and rheumatoid arthritis being the most common forms. These conditions not only cause pain, stiffness, and swelling, but can also severely impact a person's quality of life by limiting mobility and daily function. Those most at risk include older adults, women, individuals with a family history of arthritis, and those with obesity or previous joint injuries. Arthritis extends beyond joint pain, potentially leading to other health issues like cardiovascular disease and diabetes due to reduced physical activity. While arthritis may not be completely reversed, early intervention and lifestyle changes can slow its progression and improve joint function. Maintaining a healthy weight, engaging in low-impact exercises, and following an anti-inflammatory diet are key strategies for managing symptoms. Among these, vitamin D stands out for its ability to alleviate arthritis symptoms by promoting bone health, modulating the immune system, and reducing inflammation. Ensuring adequate vitamin D intake through sunlight, diet, or supplements is crucial, particularly for those at higher risk or already suffering from arthritis. Thank you for tuning in to Levitas. Please share today's video with friends and family, give it a thumbs up, subscribe, and hit the bell icon to receive notifications for future videos. Your support is appreciated. It helps us grow and create more content to empower your health. Remain tuned to Levitas for more expert advice on your health and fitness journey. So stay healthy, stay happy, and keep going.